HIV or human immunodeficiency virus is a virus that attacks the immune system, making it difficult for the body to fight off other infections and diseases. HIV is primarily transmitted through blood, semen, vaginal fluids, and breast milk. The most common ways of transmitting HIV are through unprotected sexual contact, sharing needles or other injection equipment, and mother-to-child transmission during pregnancy, childbirth, or breastfeeding. HIV can also be transmitted through blood transfusions, organ transplants, or other medical procedures that involve contact with infected blood. It is important to note that HIV can only be transmitted through certain body fluids and cannot be transmitted through casual contact such as hugging, shaking hands, or sharing utensils. There are several risk factors that increase a person's likelihood of contracting HIV. These include unprotected sexual contact. Having unprotected vaginal, anal, or oral sex with an HIV-positive partner increases the risk of contracting the virus. Sharing needles or other injection equipment. Using needles or other injection equipment that have been used by an HIV-positive person can put a person at risk of contracting the virus. Blood transfusions. In rare cases, a person may contract HIV through a blood transfusion if the blood has not been properly screened for the virus. Mother-to-child transmission. An HIV-positive mother can pass the virus to her child during pregnancy, childbirth, or breastfeeding. Men who have sex with men, MSM, are at a higher risk of contracting HIV than the general population. People who have multiple sexual partners or a history of sexually transmitted infections, STIs, are at an increased risk of contracting HIV. Protective factors against HIV include consistently and correctly using condoms during sexual activity, practicing safer sex by limiting the number of sexual partners, being in a mutually monogamous relationship with a partner who is HIV negative, getting tested and knowing the HIV status of sexual partners, being aware of and avoiding high-risk behaviors such as sharing needles or other injection equipment, taking pre-exposure prophylaxis or PrEP, or post-exposure prophylaxis or PEP as prescribed by a healthcare provider, getting vaccinated against other sexually transmitted infections, STIs, which can increase the risk of HIV transmission, using sterile needles or syringes for injecting drugs, or avoiding drug use altogether. Practicing good hygiene, regular hand washing, and keeping cuts and wounds clean can help prevent infection. Avoiding risky behaviors such as unprotected sex with multiple partners, sharing needles or other injection equipment, or engaging in other activities that may increase the risk of HIV transmission. Regular checkups. Regular checkups and testing for HIV and other STIs can help identify and address any issues early on. Knowledge and education. Being informed and educated about HIV and how it is transmitted can help individuals make safer choices and take steps to protect themselves. Support. Social support can also play a role in protecting against HIV by providing the resources, information, and support needed to make healthy decisions and access HIV prevention services. Mental health. Good mental health and addressing any underlying mental health concerns can also be a protective factor, as good mental health helps one to make better decisions and maintain healthy behaviors. Circumcision. Circumcision has been shown to be a protective factor against HIV in men. Studies have shown that circumcised men are at a lower risk of contracting HIV through heterosexual intercourse. This is believed to be due to the fact that the inner surface of the foreskin contains a higher concentration of cells that are susceptible to HIV infection. However, it is important to note that circumcision is not a complete protective measure against HIV and other sexually transmitted infections or STIs. It doesn't protect against HIV or STIs transmitted through other means such as anal intercourse or sharing needles. It should be combined with other protective measures such as consistent and correct use of condoms, practicing safer sex, and getting tested for HIV and other STIs. It is also important to note that this protective effect is only observed in heterosexual men. It does not protect from HIV contracted from men who have sex with men or through injection drugs use. If you liked the video, please give it a like, share, subscribe to the channel, and click the notification bell. Please follow me also on Facebook and Instagram. That would help me a lot. Thank you very much, and see you next time.